Urinary incontinence is involuntary loss of urination when the person wants to control but he cannot control it. And there are mainly three types. One is stress incontinence, in which because of the loss of the sphincter is one part of the organ which maintains the continence. If that is damaged because of surgery or because of elderly women where there is a descent of the pelvic muscles, that causes true incontinence, what is called as stress incontinence. The other one is urge incontinence, in which the bladder is overactive, and because of the overactivity of the bladder, the patient leaks urine before going to the loo. And then there is a mixed variety in which you have urge as well as stress incontinence. If the patient has overactive bladder, can be easily treated with medication. We have beautiful medicines like anticholinergic drugs like sulfenacin. Then there are beta-3 blockers, anticholinergic drugs, which if we give to these patients, they can easily control the urination. Those patients who have stress incontinence, for them we have surgical treatment like the transvaginal tape or transobturator tape, or sometimes if the condition is very severe, if the muscles are very poor, we might have to go for surgery like Burj-Kalpo suspension. And those patients, especially in men who have undergone prosthetic surgery or prosthetic radical surgery or bladder surgeries, if they have incontinence, then we have artificial sphincters which we can place, and they can have almost 90% control over their urination. Medical treatment is very cheap, maybe about 10 to 15 rupees per day. The TOT, that is transvaginal tape and transobturator tape, would cost about 60 to 70,000, including the tape and the hospitalization. The artificial sphincters which we use for prosthetic surgery, post-prosthetic incontinence, is very expensive. The present cost is about 3.5 lakhs, and for insertion it takes about 1 lakh. So total cost comes to around 5 lakh rupees.